So before we get started, we'd love to share our rap song introduction video, and we hope you enjoy.
Yeah, okay, organic base, this is what you need. Take you to the future, live a life that can be disease-free. All these toxins are taxing on our bodies, no doubt. All these GMOs and these processed foods we can live without. Yeah, wanna see you live a long time. Contaminants in our water and our food supply. From the meat to the dairy and the fish, what a shame. Not realizing that my insides were inflamed. Hold up, I know it's hard to digest, that's right. I found an organic plant-based website. I even got the app, yo, this is where it's at. Promoting a healthy life, it's time to put it on the map. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Assuaged, trust you don't wanna miss. It's time for you to be your best, be your healthiest. Hey, Assuaged, let's go.
Welcome. Thank you so much for joining our team of students today. We will be covering the topic of Diabetes 101. Managing your diabetes is not a science, it's an art. We'd like to thank our student speakers for their contributions today. Aysha Rahman, Crystal Rylowicz, Stephanie Brown, Huda Dawood. We'd also like to thank our slide contributors, Madison Clark, Lydia Fox, Jayashree Salian, Katherine Aybar, Sehnaz, Aysha Rahman. We'd also love to thank our Restream partner for supporting our student team. Restream's powerful multi-platform streaming capabilities have broadened our reach, connecting us with diverse communities across various social media platforms. Our message of public health and wellness now reaches those who need it the most. Today on the agenda, we will be discussing an overview of diabetes. What is diabetes? The types, symptoms, signs of diabetes. Section 2, diagnosis and treatment, self-care, blood sugar management, insulin therapy. Section 3, diabetes and mental health, complication of diabetes for the long term. Section 4, diabetes and depression, diabetes distress.
What is diabetes? Diabetes is a chronic disease caused by insufficient insulin production or ineffective insulin use, resulting in high blood glucose levels. High blood sugar, known as hyperglycemia, can damage the body systems, including nerves and blood vessels. Types of diabetics. Type 1 diabetics is characterized by deficient insulin in production and requires daily insulin administration. In 2017, there were 9 million people with type 1 diabetes, primarily in high-income countries. Its cause and means of prevention remain unknown. Type 2 diabetics affect glucose uses, leading to high blood sugar levels if untreated. It can cause serious damage to the body over time, especially to nerves and blood vessels. This type of diabetes is often preventable and can be influenced by factors such as being overweight, lack of exercise, and genetics. Types of diabetes, Part 2. Gestational diabetes. Gestational diabetes is high blood glucose during pregnancy, increasing the risk of complications for both the mother and the baby. There are also at a higher risk of developing type 2 diabetes in the future. Impaired glucose tolerance and impaired fasting glycemia. IGT and IFG are intermediate conditions in the transition between normality and diabetics. People with IGT and IFG have a high risk of progressing to type 2 diabetes, although it can be prevented with adequate care. Symptoms. The symptoms include symptoms for type 1 and 2 diabetes urinate a lot, often at night, very thirsty, very blurry vision, numb and tingling hands or feet, feel very tired, very dry skin, sore that heal slowly, more infections than usual. Gestational diabetes, diabetes during pregnancy usually does not have any symptoms. If you're pregnant, your doctor should test you for gestational diabetes between 24 and 28 weeks of pregnancy if needed. You can make changes to protect your health and your baby's health. Diagnosis. Diagnoses include our average blood glucose. The A1C test measures your average blood glucose over a without any fasting or drinking requirements. Second, fasting plasma glucose. It is a fasting blood glucose test requires at least 8 hours of not eating or drinking except water before the test, usually in the morning before breakfast. Number 3, oral glucose tolerance test is a 2-hour test that checks blood glucose levels before and 2 hours after drinking a special sweet drink. It tells the doctor how your body processes sugar. Number 4, random, also called casual plasma glucose test. This test is a blood check at any time of the day when you have diabetic symptoms. Okay. Diagnosis for high blood glucose. There are several ways to diagnose diabetics. Each usually needs to be repeated on a second day to diagnose diabetes. Testing should be carried out in a healthcare setting, such as a doctor's office or lab. If a doctor determines that blood glucose or blood sugar level is very high, or if there are classical symptoms of high blood glucose in addition to one positive test, a doctor may not require a second test to diagnose diabetics.
Now let's discuss some self-care tips for monitoring blood sugar. How do I check for blood sugar? Diabetics can use a glucose meter or CGM to monitor glucose levels in real time, eliminating the need for finger pricks. How to use a blood glucose monitor. First, after washing your hands, insert a test strip into your meter. Then, using your lancing device on the side of your fingertip to get a drop of the blood. Then, touch and hold the edge of the test strip to the drop of blood and wait for the result. Finally, your blood glucose level will appear on the meter's display. What are the target ranges? Blood glucose targets are individualized based on age, life expectancy, duration of diabetes, underlying conditions, cardiovascular disease, and hypoglycemia unawareness. The ADA recommends A1C targets based on age and health for non-pregnant adults with diabetes, and individual goals may vary. A1C less than 7%. A1C may also be reported as EAG, less than 154 milligrams per deciliters. Before a meal, preprandial plasma glucose, 80 to 130 milligrams per deciliters, and 1 to 2 hours after beginning of the meal, postprandial plasma glucose, less than 180 milligrams per deciliters. Blood sugar management. What can you do? You can prevent or delay type 2 diabetes. Lose weight, eat healthy, be more active. Also, work with a health professional to, again, eat healthy, stay active. You can manage diabetes. Why monitor blood glucose? First, to keep blood glucose within the target range. To adhere to diabetes care plan. It helps to balance the foods and physical activity. To present the log to healthcare provider. And also it allows to make changes in medications if needed. lifestyle modifications, medication, and insulin therapy for managing diabetes. For those with diabetes, the best thing to do is see a physician who can help you explore your options. Health can be aided with many different things such as insulin, exercise, diet modifications, and blood sugar monitoring. Getting the correct dosage on insulin and taking it correctly can help people regulate their glucose levels. Eating enough during the day, but also healthy, can make a change. A balanced meal will provide for the body as well as fill you in. Portion sizing matters just as much as the ingredients. Exercising can be a combination of things. From a walk around the block to going to the gym, working out is just getting the body in motion. According to the Center of Disease Control, 25 exercise minutes per week can make a difference. Complications of diabetes in the long term. Long-term effects of untreated diabetes can be severe. Diabetes affects the body in many ways. The heart, eyes, kidneys, nerves, skin, and more will experience changes. These may cause kidney damage and possible failure, eyesight can become impaired, and new sensitivity to light may develop. Blood flow may slow in the heart and many other vital organs. This increases the risk of heart failure and/or stroke. Immune system will weaken and can cause more illnesses and frequency of sickness because of a lack of protection from pathogens. And finally, men in some cases may suffer to get an erection. Women will start to miss menstrual cycles.
Diabetes and mental health includes psychological insulin resistance. Psychological insulin resistance is the avoidance of insulin medication due to fear, denial, or lack of trust. Not taking insulin can cause severe diabetes effects. Anxiety. Anxiety related to diabetic symptoms is common. Stress can turn into fear, with 15% of children with type 1 diabetes having anxiety, around 1/3 of people with mental health disorders and diabetes. Overestimating severe complications is common. Mental health and neurological disorders. Mental health and neurological disorders can increase the risk of diabetes, with genetic factors and body stress being common links. In PTSD, the risk is 40% for type 2 diabetes. Trauma. Diabetes can cause trauma during hypoglycemic episodes, leading to confusion, anxiety, and depression. Maintaining high blood sugar levels is a typical but harmful response. Talking to a doctor or therapist about insulin concerns or fears for proper treatment. Most are 100 times more afraid of losing part of a leg to diabetes than death. A phobia of diabetes may develop in OCD, but diabetes should still be tested for if it is a concern. Contagious glucose monitoring systems can help reduce fear of hypoglycemia. D&D, diabetes and depression. Rates of depression and major depressive disorder are doubled in those with diabetes. In depression, rates of diabetes are 40 to 60% higher. Mental health screening is recommended at the time of diabetes diagnosis and regularly in those with diabetes, as depression and other mental health disorders are common. Untreated mental health issues often affect diabetes self-care. Stress management techniques, family therapy, diabetes education, forming a strong social support network, and traditional therapy can all help with both mental health and diabetes. Diabetes distress. 4 common stressors. Diabetes distress has been most shown to have the strongest effect in causing adverse diabetes outcomes, and that's reported by Robinson et al., Diabetes and Mental Health. The first part is living with diabetes. Living with diabetes is emotionally challenging due to the many physical and psychological health risks and negative attitudes towards the disease. S is social relationships. Stress and mental health issues can affect social relationships in children, Parental mental health problems can impact mental health and diabetes. H is the third stressor and stands for healthcare provider relationships. Finding healthcare professionals that are a good fit or even just responsive to needs and concerns can be difficult. This can lead to serious stress. And the last S is self-management. The continual monitoring and managing diabetes is stressful, especially when other conditions need attention, support is lacking, or trauma affects self-care. Physical exercise for type 2 diabetes. Although exercise helps counter diabetes by promoting weight loss and increasing insulin sensitivity, certain types provide added benefits. Aerobic exercise improves health for people with diabetes by lowering blood pressure, triglyceride levels, and A1C results. It can also reduce cardiovascular and overall death risks. Resistance training can help counter the negative effect of diabetes on muscle strength by increasing muscle mass and strength. Other types of exercise include older adults with diabetes may experience balance and flexibility limitations. Stretching exercises and balance training can help. Tai Chi can also improve balance and reduce diabetes symptoms affecting the nervous system.
All right, we are now on the questions portion, and Stephanie will be taking those over for us.
All right. First question, how can I learn to accept my diabetes? In order to manage diabetes, it's important to understand that it's a permanent part of your life. However, it's also a treatable disease that doesn't have to limit you if you follow treatment recommendations. Accepting the reality of the situation is key. As David Marrero, PhD, who has diabetes and is the director of Diabetes Translational Research Center at the Indiana University School of Medicine, said, while we all wish it would simply go away, that isn't possible yet. Second question, will insulin make me gain weight? Insulin processes calories and pushes glucose into cells for energy. For this reason, it can, but doesn't have to, cause weight gain. Practicing portion control and exercise can prevent potential weight gain. High blood sugar may cause calorie excretion in urine, but once under control, this won't be an issue. Hypoglycemia should be treated promptly with 15 grams of carbs. Question 3, what can I do to help prevent diabetes? If you have prediabetes, there are various steps you can take to enhance your well-being and lower the chances of developing type 2 diabetes. Moderating your sugar consumption, engaging in regular physical activity, emphasizing water consumption, managing your weight, introducing more fiber into your diet, ensuring adequate intake of vitamin D, and abstaining from smoking. Question number 4. What education or program is available for diabetics? Individuals with diabetes should consider participating in patient education programs, commonly called structured education. The DSMES program provides practical skills and support for individuals with diabetes, regardless of their stage or type of diabetes. You're not in it alone. DSMES can also help to improve blood sugar levels and prevent complications of diabetes, leading to better overall health, cost savings, and enhanced quality of life.
All right, that was a great discussion you guys prepared. Thank you so much for joining today's call. I felt like that was very comprehensive in terms of the information that the students provided, but I would like to open up to a Q and what expanding upon our knowledge in diabetes. I know I had previously mentioned that, you know, I have a sister that has type 1 diabetes. I had a best friend that died from type 1 diabetes. My grandfather. It is a terrible condition if it's not managed properly. And there's a lot of mental health that plays into that. So what are some things, Aysha, starting with you, that you can kind of denote in terms of your experience and knowledge about type 1 diabetes?
Thank you. So I have a family history of type 2 diabetes, not the type 1. My both parents had a type 2 diabetes, and so ever since they have diabetes, so I was told by my doctor that I could have a diabetics, you know, down the road. So I have to watch out what I'm eating every day, you know, having healthy lifestyle, and also going back to the questions, you know, the first question is about how to accept the diabetics. You know, if a person diagnosed with diabetics is emotional burden, I would say. You know, the best way to overcome it, I believe, you know, speaking with someone, loved ones, especially loved one, or doctors, anyone can be comfortable with, you know, just supporting emotions, and also to regulate your feelings, how you feel, because this is the first step we have to take, how to accept because I'm scared when doctors say make sure you do blood tests every 6 months because have your history. So I'm scared because I watch out anything I eat, but sometimes, you know, you love, who doesn't love sugar? Like, who doesn't like cake and all that? But still, I have to watch out those few things that, you know, exercising every day, make sure I don't gain weight. You know, overweight is one of the, you know, biggest reason that people get diabetic. Yeah.
You know, that's interesting you say that, you know, there is a fear around that, especially, you know, if you've been exposed to it. For the most part, I could say type 1 diabetes is genetic. There's really no way around it. And from what I've seen, both my sister and my best friend that had passed, they got diabetes very young, like around 13, 14. So, you know, typically when there's a genetic disposition, you'll notice that it does occur younger in life. But I know my grandfather, he came down with it older in his life, and, you know, when he was in elderly care. So it can definitely vary in range. What do you think, Stephanie, on all of this?
Just to piggyback what Aysha said, yes, it's important for diet and exercise. That's a major part. But what I would like to contribute, because I did have my stepfather passed away from being type 2 diabetic because he wasn't taking his medication. So what I would like to contribute is how important making sure that if you have that diagnosis, not only do you watch your diet and exercise is important, but testing yourself, making sure that you're properly testing yourself so that you know where your levels are at, so that you can properly take your medication, because that plays a major factor in it when you have diabetes. If you're, you know, making sure you're taking your insulin when you're supposed to, and just testing yourself so that you know if your sugar levels is too high or too low. So I think that's the part I'd like to contribute.
Thank you so much.
Medication management.
Yeah, absolutely. And I know even during my pregnancy, they gave me like a monitor and all this stuff, because I guess it's very common during pregnancy to get pre-gestational diabetes.
Gestational diabetics, yes. You would need to drink a sweet drink.
Yeah, I didn't do that. I opted out of
straight. Yeah. You didn't do that?
No, I was scared. I was like, because they wanted me to drink something, and I was like, okay. And then they're like, you have to sit there for like 2 hours, and I'm like, I can't leave. And they're like, no. And I'm like, why can't I leave? And they're like, in case anything goes wrong. And I'm like, well, in that case, I don't want to drink something if something could go wrong. So they sent me like the monitor and the sticks and everything to you know, do it at home for 2 weeks instead of to drink. So I got out of drink. I don't know. I didn't want to. Crystal, what do you think, my dear?
Well, I have a history on both with type 1 and type 2. And it's very scary because my sister was 8 years old and nobody knew she hadn't been tested for diabetes. And she was a little on the pudgy side. And one night, my mother went to work and my other sister was babysitting. And she passed out and became non-responsive. And by the time they took her to the children's hospital, it took them 36 hours to figure out what was wrong with her. And so she went into a diabetic coma. And so I'm not too familiar with type 2 diabetes. All I can contribute is no matter what age you are, whether you have type 1 or type 2, self-care is very important with emotional support, whether it be from school, your medical provider, your family, because you can't handle it all on your own. You just can't.
Yeah, no, absolutely. Diabetes is, as I was stating before, we have so much experience with that. With my best friend, she just literally, like, we were partying and drinking. Like, this is when I was like I was like 19 when I had met my husband, and so we were having all this fun, and I really didn't understand. She had to take her insulin shots. I really didn't understand her illness. I just knew we went to In-N-Out a lot. We, hot Cheetos and drinking and then, once like all of that caught up with her real fast.
Yeah.
And then all of a sudden, we had gotten married to our husbands and we moved to different states. And she got pregnant and ended up giving birth to an 8-month stillborn. And it was traumatic. Her body was just not strong enough. And that's when she started declining, like, rapidly. And, she just, being diagnosed diabetic in her young age of, I think, 13, she never really managed her condition that well. And so, you have to be careful for the rest of your life when you have type 1 diabetes. And it's not a joke. I mean, it's your eyes, it's your limbs, it's your heart, it's your stress levels. It's absolutely everything, drinking and smoking. It's definitely not a normal life. It's always living in caution. And, when your blood sugar is too high, your mentality kind of goes to mush, and, you could be negative towards people and combative. And it's got a deep compounded root of mental illness, I would say, that I've personally witnessed with, my best friend and my sister. You just can't control, like, when you're feeling like horrible, your blood sugar's low and all you could do is walk it off or take a tablet, a sugar tablet. So I don't know, it's definitely a different life, and I wouldn't wish this kind of condition on anyone, and management is self-key to getting through all of that. And I got a fussy baby. So but yeah, I mean, thank you guys so much for contributing your opinions and experiences. I think this is going to be a great PowerPoint for our viewers to watch, and you guys did such an excellent job on did you guys want to add anything? No. All right, so we will go ahead and close it for today. Thank you guys for joining us and our student team. Aysha, Huda, Crystal, Stephanie, really appreciate you joining the call and adding all your insights, and we will see you guys next time. Thank you.
Thank you.